a lot to cover in a very short time, but we will have a bit more time in the conversation. And Valerie, you've also, of course, looked at this area as well, and at the psychosocial environmental questions and some of the issues associated with funding. So in 5 minutes or less, can you also give us a tour?
Well, I'm going to be looking at this, apologize for the screen. I'm going to be looking at this a little bit from, there we go, the 30,000 foot level. So you might think of Sarah's research as a potential project that we might fund. And so just going to talk about the big picture of our kind of operational framework and mission, and then look at what those particular challenges might be in terms of the next steps. So I want to start broadly with the mission of the NIH. We are the nation's largest biomedical and behavioral sciences research agency. We fall under the auspices of the Department of Health and Human Services. And you can see that part of what our goal is to generate new knowledge, discoveries to help address some of these compelling and seemingly intractable public health conditions, and to promote health and well-being of the nation. So we talk about health for the nation. To do that, we look at some of the causes, diagnosis, prevention of diseases, growth and development, biological effects, all the kinds of things that Sarah talked about. And what's implicit in that statement is that there's an expectation of problems, there's an expectation of disease and disability. So the goal of kind of looking at well-being not only as the absence of disease and other kinds of public health concerns, but the presence of well-being is an area which I think we're moving toward, but we have a good deal of work to do. 27 institutes and centers make up the National Institutes of Health, and I am at the NICHD, so all of that long introduction, you can just say NICHD, the National Institute of Child Health and Human Development. And our goal is to look at the human development from conception throughout the life course to throughout the aging process. And in doing that, there's this recognition that there are events that happen prior to and throughout pregnancy. We have studies now that are focused on looking at the placenta and how we understand the developmental origins of health and disease, even from that early environment of the child. During childhood and all of these developmental epochs throughout the life course, understanding that life is complex, that development is complex. And in doing and in looking at that complexity, we have to study what kind of focus in on particular public health concerns or particular conditions, particular areas of challenge and problems that we might identify, to isolate those in order to study them. So our mission is very broad and focuses on the ideal that we want all children to be born healthy and to have every opportunity available to lead productive and a healthy life. And so implicit in that statement, of course, is well-being, but to achieve that, we have to look at and drill down to finding what those challenges are. What are those factors that place a child on an optimal course of development, and what are those other factors that might take a child off of that more optimal course, so that we can then look at those problems that Sarah talked about, and look at and understand adversity and how those things might get under the skin. And in fact, one of the challenges, I would say, is that even in applying for grants, investigators have to identify the problem. They have to focus on those challenges. Oftentimes, applications that just look at protective factors without looking at the broader context of risk and all of those other aspects of a child's psychosocial ecology may or may not fare as well, because they want to look at that broader context within which the child lives and grows and functions. so that we can understand how that particular condition might be affected and might unfold throughout the life course. So I just did a basic search through the NIH reporter, which you all can do too. This is public information. This is a database of funded research, and just did a very, very gross search on well-being, child well-being, over the last 10 years. And you can see that I don't know how clear all of these are, but you can see that we have funded a number of grants over the years, and collectively they focus on these broad rubrics. I think emerge from the various individual grants that we look at, and you can see that focusing on family structure, mental health, long-term outcomes, the life course are really important, but also health disparities as well. One challenge that I might point out is that in looking at health disparities and in looking at inequities and isolating some conditions and diseases and areas of special need, that we don't consign children and families and populations to that condition, but that we look at other alternatives, other ways of expressing and identifying how we might provide interventions for support. One thing I want to point out, and I know my time is up, that largely what do we do when that research is funded, when you have investigators like Sarah who conduct these studies? Most of that research is published in papers in scientific journals. It's a disincentive, I would say, for investigators, especially early in their career, to maybe take this information and put it in more public access domains for the general lay population. But that what is a boon to their career is that if they get their papers published in a major scientific journal, and you can see here that we promote that, and we applaud researchers for doing that. Even in the review of their applications, we look at people's track records of publications to determine whether they have the wherewithal to carry out the study as they proposed it. So that's really a strength. But on the other hand, if we want to get this wonderful information into the hands of the intended beneficiaries, the people who need it, we also have to think about other ways of sharing that information. So more recently, I would say within the last maybe 10 years or so, at least that I've been able to track, we've been focusing on dissemination and implementation with the recognition that we need to spend much more time sharing those lessons learned, that we need to make sure that there's widespread uptake of evidence-based practices, and that we close the gap in terms of discovery in healthcare and the provision of services. So I'll stop there.
Great.